Hello, everyone. Welcome to our Facebook Live and a webinar through Zoom. My name is Ken Patel. I'm a pharmacist from Right Way Pharmacy. As you all know, I'm really committed to improving quality of life. And our pharmacy, we do quite a few different things like CBD, electromagnetic therapy, or pulse electromagnetic therapy. But today I have somebody very uh, different approach that Dr. Amy Novotny, and she's a doctor who's been doing a lot of things. Let me read her bio, and you will realize what she has done, and then she will help us understand how to improve or manage our pain, anxiety through a breathing technique. So Dr. Amy Novotny founded a PABR Institute with a mission to provide pain, stress, and anxiety relief to those who seek a naturalistic form of treatment, and other treatment methods have fallen short. So her unique approach comes from her experience treating a wide variety of in settings with a wide range of patient populations over the past 11 years. Her background in orthopedics, sports, geriatric balance disorders, nerve injuries, and most recently, chronic pain, and influences from the courseworks of Postural Restoration Institute gave her the foundation to develop this treatment method to address wide variety of painful and restrictive conditions. Her methods have helped countless people reduce and eliminate pain, stress, anxiety, orthopedic surgeries, sleep issues, and the need for medications. She has co-authored two Amazon's #1 best-selling books, Don't Quit, Stories of Persistence, Courage, and Faith, and Success Habit for Superachievers, which share her journey on how and why she developed PABR method. Her ability to speak French, Spanish has allowed her to communicate with and help various clients from all around the world, including France, Mexico, Central America, and South America. She has a variety of interests, including running 40 plus marathons, running 10 ultra marathons, including 200-milers, completing an Ironman triathlon, photographing wildlife and landscape all over the world has led her to several of her images being chosen as the photos of the day, most notably in National Geographic Your Shot World Top Photo of the Day. You can visit her portfolio on Amy Impressions, www.amysimpressions.com. Now, she's very humble and gracious to share her knowledge with us. So, Dr. Amy, welcome. Thank you so much for giving us your time and helping us see what you do and how it can help patients all around the world and in Sun City too.
Absolutely. Thank you so much for having me on here today, Ken. I really appreciate you giving me the chance to share with your friends, your clients, your patients, anyone who is available to listen. So right now, we're all striving to find ways to boost our immune system, to heal, to just improve our overall health. And one of the things that I like to talk about is there's so much we can do if we work on ourselves internally. And we hear that a lot. And so some of that comes with spiritual healing, emotional healing, and mental healing. And what I'm actually talking about is actually physical healing from within and learning how to control yourself and your nervous system so that you can change the way your body feels, moves, behaves, and it even influences your mental and emotional health as well. So we're going to go through today some of the science and some of the reasons why I teach what I do and I coach people in this type of healing with people all over the world. I have clients internationally all over the US, and I do it all through Zoom because you don't have to have someone's hands on you to change your body and to transform your body. You can learn how to do this by someone communicating you how your body needs to change. And that's the key. Is my job with someone really depends on how well I can communicate and get them to sense and feel things differently. If I can't do that, then that's where I need to learn how to do something better, because everyone has the ability to change the way they feel and the way they move. as long as they're able to, receive information, process, and remember it.
Gotcha.
Now, the important things we're going to go through today are 3 different topics. 1 is your body position, 2 is your nervous system, and 3 is the way you breathe. All 3 of those influence whether you're in pain or not in pain, whether your stress levels increase or decrease. They can influence your sleep quality, how well you can go to sleep and stay asleep. It can influence whether or not you need an orthopedic surgery, like a joint replacement or not. It can influence also how much medication you're taking. So I want to go through that because these are important changes that you have the power over, and you can still get help from people. Always recommend getting help from healthcare providers who have your best interest in heart, like Ken does here, because this is absolutely wonderful. A pharmacist is bringing someone else in to share and improve your health. So please take advantage of Ken and his knowledge. It sounds like he has a lot to offer you all. Now, let's go through the first thing. I'm going to stand up because this is important, and I'm going to give you a little demonstration based on our bodies. Now, most of us remember when we were little kids, we were taught shoulders back, chest out, suck up your gut, hold your core tight, hold it strong. We're taught this by parents. We're taught this by teachers, gym instructors. If you do any type of performing arts, if you do marching band, any type of military, anything like that, we are taught to keep ourselves in this rigid posture. If you do any type of speaking, any performance types of things, we're taught that. Now, what I want to do is go through why that does not serve your body and does not help you, and why it actually can lead to aches and pains and joints that are butting up or tissues that are butting up against each other that leads to surgeries, joint replacements, or other type of decompression surgeries, or even medications. Now, if you think about your rib cage, I'm going to give a demonstration. If you think about your rib cage is a cylinder. Now, that cylinder is designed to protect whatever is on the inside. So for us human beings, it's our spinal cord, it's our organs. Those are the things that we're protecting with this structure called our rib cage. Now, the way our rib cage works, a cylinder needs to be in the correct position to provide that. If we take that cylinder and we say, okay, now chest up, shoulders back, suck up your gut, you take a cylinder of your rib cage. Now you're lifting up the front of the rib cage. The backside goes back down. Now your rib cage is on a hinge. It's no longer in that neutral position. It's now up. As soon as I do that and lift up the front of my rib cage to create that perfect posture, now my back, my low back, becomes a hinge. I know so many people have low back issues, low back pain, and we wonder why. Well, it's because your body has learned to hinge off of your low back. Those muscles contract. As you lift up your rib cage, those muscles learn how to contract, and then they never stop. Our bodies are beautiful and amazing, and they know how to habituate, but the problem is they habituate in situations where we don't really need it to habituate, and then our back muscles become tighter and tighter and tighter, and we wonder why we have back pain. We wonder why we have herniated discs, sciatica, slip disc, burst disc, anything you can think of, degenerative disc disease. Our back muscles get tighter and tighter, and then we're taught when we have back pain to strengthen our back. So guess what? We pull them tighter and tighter again. Now, if we think about it, if we tip our rib cage up in that perfect posture, if we did only that, we would fall backwards. So because the way that we get away from that is if we lift up our chest, our pelvis then tips forward for us to be able to stabilize ourselves. Now, as soon as you tip that pelvis forward, guess what? You decrease space for your hip joints, okay? They now have less space for movement of your femur bone in that socket. And that's something we don't want. That's when you start getting impingement, wear and tear, degeneration of your cartilage because there's decreased space and tissues butt up against each other, all based on how we position ourselves. And then it goes up and down that chain. So if our pelvis tips forward, We decrease the hip space. You can feel your body weight shifts forward over the front of your feet. Pain goes down the front of your knees. You can get wear and tear on the front of your knees, on the inside, and also things like issues with your feet, bunions, plantar fasciitis, Morton's neuroma, hammer toes, all those things that we commonly see can be contributed to based on how we position our body, and our muscles have to respond to hold us there. If our muscles are responding abnormally, you're going to hear about it because your body's going to talk to you. Pain is a signal from your body to your brain that something is out of position if it develops gradually, insidiously. Obviously, that's different if you have a trauma or some kind of, tumor or something like that. But when something just happens gradually or overnight, really think about it. Pain as being a signal that your body's out of position. And now it's our job to figure out how it's out of position, how to change that. Do we seek help to get that? What are our options? Now, with that body position I just talked to you about, with your pelvis tip forward, chest up, shoulders up, lower ribs are flared out. Now, if we look at the upper body, if my chest is forward and I'm pulling my shoulder blades back, now I've decreased space available in my shoulder joints. I can easily get wear and tear in my shoulder joints. My motion's going to be decreased. I can get rotator cuff issues, labral issues, impingement, all of those things. And it can go up to the neck because as my chest is out, my shoulders are back, my head may slide forward, and all those muscles in the back of the neck become rods and become hard because your head cannot just be in a natural position with our chest down. Can lead to TMJ issues, jaw issues, headaches, migraines. Pretty much covered a ton of those issues out of there. Can lead to muscle, nerve issues down your arms, down your legs. You name it, it's pretty much out there. Now, we don't realize that by simply sticking out our chest, we can have all these things that happen. I want to explain a little bit how that happens. Now, over time, our body gets used to whatever position we put it in, okay? We have a nervous system in our body called our autonomic nervous system. It has 3 components. Your enteric nervous system, which is your gut. We're not really going to cover that today. Then your parasympathetic nervous system, which is that ability to rest, digest, relax, chill out, repose. And then you have your sympathetic nervous system, which is fight or flight mode, you're freezing, you're acting, all of that. And those are the 2 systems we're going to talk about. And I'm going to relate how this all matters. If you think about every stressor in your daily life, work, finances, relationships, kids, relatives, unfortunately, all the stuff going on in the world right now with the pandemic and riots and, everything that's out there right now. Every single stressor that we have kicks us into fight or flight mode. Now, the common thing we hear about is our cortisol levels increase and some changes in our system. But what we don't realize is that when we have a stressor, there is a response in our musculature. Our muscles go into a guarding mode and tense up. I often hear people say they have tight hamstrings, they're not flexible, they feel buzzed. All of those are signs that your nervous system are ramped up and that you can't calm yourself down and breathe differently, okay? Because every time you get a stressor, the muscles contract. If you don't recognize that and release those muscles back down into parasympathetic mode, you now are at that new level of a heightened nervous system state. You habituate. And then you get another stressor. You may not recognize it, maybe another stressor. And all of a sudden, you're just going higher and higher until at one point you hit a threshold. And you wake up one day, you've had a couple new stressors in life, you wake up one day and you're now above that threshold and you have pain. You're like, basically, what happened? I didn't do anything different. Pain just showed up. What happened? But you can't get out of it because you forgot how to get out of it at each step before that. And what had happened was as your muscles were tightening up and they're tightening on a body that's not in a neutral position, the way we have positioned ourselves already decreased the joint space. Now we have muscles that are tightening on top of that decreased joint space. And then they've tightened just enough. They've held on to joints just enough that you go to wake up the next day and you go to move and you get, ow, because the tissues are pinching together. And you can't do anything about it. And you may wait a day or two, the pain doesn't go away. So you have to go get help. And there's a lot of external sources out there that can help. There's medications, there's acupuncture, there's physical therapy, there's massage therapy, there's dry needling, there's cupping, there's all these different resources. And sometimes they help. Sometimes they bring you off of that threshold and they can bring you back down and allow you to exist somewhere up in here, not down here. All these external things can provide help. I know, because I treated people like that for about 5 years before I started realizing I need to make an internal change in people. I need to get them from this threshold or somewhere around in here and teach them how to change their nervous system back down to here. And that's what we do. And the key is I teach you how to do that to yourself so no one can take it away from you and you don't have to rely on anyone, so that you can do this no matter where you are in the world. Doesn't matter if you're traveling, if you're on vacation, if you're at home, if you're in the bathroom, if you're in bed, it doesn't matter. You can change yourself in the state that you're in because you know how to control your nervous system. Now, I've already talked about one way that we can control our nervous system is how we position our body. Now, I don't say your posture, because when we think about posture, we're thinking about standing up straight or sitting up tall. It's not that. It's how you position your rib cage and the bones that attach to it. Now, the reason why I say that, and that's important, is because that fight or flight nervous system that I'm talking about lies in your back. So think about it. Every time you go chest out, shoulders back, let me flatten that curvature in my back. Guess what nervous system you are crushing on constantly? That's fight or flight nervous system. You are telling your body, go tighten up. Okay? So I go against all advice out there and I say, let your belly out. Let yourself have a pooch, because your belly button is the gatekeeper to your rib cage. If I suck this in, my rib cage goes up, my fight or flight nervous system kicks in, muscles tighten up all over my body, I become inflexible. I become ramped up. I've just now added a new stressor to my life, and that's my physical stressor, which is now going to affect me mentally and emotionally and how I handle the world around me. Instead, I can let my belly out so my rib cage drops down and I can feel tension in my body let go, because I stopped compressing on my nervous system back there. Now, that's one way. Obviously, it's more involved than that, but that will at least get you started. The other way is how we breathe, and that's closely tied to our ribcage position. So our breathing is affected by our ribcage position and affects our nervous system. There's a nerve called your vagus nerve that goes down through our body, through our diaphragm, and when our diaphragm's working and contracting and going up and down, it stimulates that vagus nerve to calm us down. Now, how do we get to that diaphragm? We've all heard about belly breathing in our diaphragm, and we're taught, okay, let's push that belly out as we breathe in, and we're kind of doing this breathing in and out type of thing. Now, I tell people that's not necessarily diaphragmatic breathing, and here's why. Our diaphragm is a dome on top of walls, okay? So when you inhale, that dome drops down. It creates negative space for air to flow into. When you exhale, the dome goes back up, okay? So you inhale, dome goes down, creates space, air goes into your lungs. Now, in order for this dome to go up and down and stimulate that nerve, that vagus nerve to calm us down, that dome needs to have a strong base of support, which is the walls of the diaphragm, okay? If those walls are weak or not supported, the dome is not going to be able to contract down because there's nothing to buffer, buttress it. Now, the thing that supports those walls are your side abdominal muscles that help hold your ribs down. So if I'm in chest up, shoulders out, ribs flared out position, I'm not using my side abs. So that means I'm not providing support for that diaphragm wall. So that means it's going to be hard for that dome to drop down. So when my chest is out, shoulders are back, and my ribs are flared out, guess how I breathe in? I have to lift up my shoulders, lift up my ribs, sometimes lift up my head or arch my back to get air in. When I do that, my breathing is going to be more shallow, which is going to signal to my brainstem that I'm in fight or flight mode. Plus, I'm not accessing my diaphragm to the point that where I need to, so I'm not stimulating the vagus nerve. So again, I'm telling myself like a double whammy that I'm in fight or flight mode, all because of how I positioned my rib cage, which I have complete and utter control over. Something that you choose. No one else chooses for you. So we can make a huge impact on our rib cage position to influence how we breathe. So if we drop that rib cage down, ribs drop down, belly comes out. Now my ribs are down, my side abs are helping hold it down. I have support for the walls of the diaphragm. The dome can contract down. Now when I breathe in, I just filled up my lungs. You didn't see me move. I wasn't using all of these accessory muscles to get air in. I wasn't going to use my upper traps. Think about all those knots that you have in your body. You don't have to use those muscles, overuse those muscles for the simple act of breathing 12 to 18 times a minute. You don't have to overuse them. They don't have to be tight. They can actually learn to exist as soft. Your ribs can learn how to move again. You can drop those ribs down. You can let the belly out. You can learn how to relax. You can free yourself up from pain. So as you can see, the way you position this rib cage influences how you breathe. The way you position your rib cage influences your fight or flight nervous system. And how you breathe influences that fight or flight nervous system in two ways. So all three of these are intertwined. And it's hard to tease them apart. And we kind of don't want to tease them apart because we want to have the beneficial influence of changing those three things so that our body can free up. So I'll give you a little stories. When people are like, well, okay, how does that help me with knee pain? I have knee arthritis, it's bone on bone. My doctors tell me I have pain. It's arthritis. Okay. So I'm going to tell you a little story. It's a woman. She's a retired psychologist now, but she was also a psychiatric nurse. So she gave herself to the Arizona community for 30, 40 some years. Very well respected in the healthcare profession. She had bone on bone knee pain. Bone on Bone was doing injections 3 times a year, daily anti-inflammatories for years. She's also an amazing photographer and world traveler, travels all over the world photographing animals, wildlife, nature, you name it. She needs to be able to hike. So what did she do? She got injections every time she went on a trip just to be able to get through the trips. Just walking on cobblestones caused her pain. Climbing in and out of a Zodiac drug her up. She wanted to do it, got to get some drugs in her just to be able to help her do that. And those things gave her the ability to do that, but she didn't realize that there was something else that she can do by changing herself internally. So it didn't touch her knee. It didn't work on her knee. All I did was change the way she positioned her body, the way she breathed. She calmed down her nervous system. Her trunk went back into neutral. Her pelvis went back into neutral. Pain went away. Her knee motion returned. She hasn't had one more shot since June of 2016. She hasn't had any more inflammatory since then. She now climbs in and out of Zodiacs without medication, without trouble, all by herself. She climbs hills. She carries large photography equipment, all because she changed her own nervous system. I just provided her the tools. And sometimes to change our lives, we need to meet just that one person that helps us and guides us on that process. Because ultimately it's all up to ourselves to change and transform. Other people can't do it for us. We can provide you assistance through medications, other treatments, but it's really up to you if you want to change. And I'm telling you, there is a process to do that, and you can do that. So what I want to go through now is get you started on a simple breathing process to get you guys going. Okay. We're going to start by doing this seated. Okay. Today it's going to be about, let's give you a position so you can start practicing. And then if you want to do more, you can contact me and we can set something up. But first, We just want to get you the basics so you can get started, so you can practice this, get going, because everyone should have these basics under their belt. Now, I'd love for you to sit in a chair that has a back to it. Okay. So I have a chair here. I'm going to show you. It has a back to it. No lumbar support. It leans back a little bit, but there's no lumbar support at all. I don't want something behind my back that shoves me forward. I want my back to be able to relax into the chair back so my tailbone can curl underneath me so the back muscles can turn off, especially as my ribs drop down. So as I sit in the chair, I want my low back here just to relax into the chair back. I'm just going to let my upper back just sit all the way into the chair back. That's step one. Now, the other extremely important part about a chair is that your feet touch the ground, your heels hit the ground, and your knees are the height of your hips or higher than your hips. We don't want your knees lower than your hips, because as soon as your knees are lower than your hips, guess what? Your pelvis tips forward, you arch your back. Now, if you have a chair, we are all different size people. If you have a chair that can't lower, put some books under your feet, foam books, wooden planks, step stool, anything like that, just to get your feet elevated, and you'll feel a difference. As soon as you get your knees just above your hips, you can feel how your tailbone can curl underneath you and your low back can relax. It's huge improvement on low back pain. Can't even tell you how many people just cure their low back pain just by that thing alone, especially if they're sedentary or working behind a desk or, just enjoy sitting. Now, the other thing that we're going to do is go through some 4 steps of breathing. Okay. I have a straw here, and I use a straw to teach people how to breathe differently because it provides so many benefits. It gets us to blow out into a cylinder so our rib cage can drop down into a cylinder. I take a regular straw. This is a paper one that I cut in half just to make it easier on the cheek muscles, just because it's a little bit hard holding a big straw up. Now, if you have a straw, you can practice with this. I really recommend it. And you'll just put it between your lips, not between your teeth. We're going to start with 4 steps for breathing, and then it'll get a little bit more complicated. I'm going to demonstrate on me first, then I'll coach you guys through it and give you a little bit of a tutorial. So the 4 steps to start breathing are breathing in through your nose, pause a second, blow out through the mouth, pause and hold your breath for 3 seconds. Now that seems easy, but that's just the beginning. As we go through this, it will get more complicated. But those 4 steps of breathing in your nose, pause a second, blow out through the mouth, then hold your breath and pause 3 seconds are the beginning. Now that pace, you might have to go a faster pace depending on your ability to breathe, how much fight or flight status. If you can't hold your breath for the 3 seconds, you already know your rib cage is elevated and you're in fight or flight mode, just with that alone, okay? And that's something you can change. Everything I've talked about so far are things that you can change, and you can practice with this technique that I'm teaching you. And again, it goes beyond this, but this will get you started. Here we go. I'm going to demonstrate, and I want you to watch as I'm doing this breathing. I want you to watch my head, my neck, my shoulders, my chest, and my belly, and see if you can see much movement. Here we go. Okay, so as you can see, you probably didn't see much movement. You didn't see me lifting up, my head cocking back, and I show you that so you know what's possible. It's great to do this in front of a mirror so you guys can see what your body's natural tendencies are, and sometimes you can just feel it yourself. But a lot of times I'll have people whose heads lift up and I'll let them know that. They didn't even know that. They didn't even know, and then they wonder why they have neck pain. Or they they stick their they try to do diaphragmatic breathing and they push their belly out, and all they're doing is arching their low back. Didn't even realize that. So this is something good to do in front of a mirror or to record yourself so you're not looking at the mirror, but just to see what your body's natural tendencies are. You can pull out your cell phone and record yourself, set it up. It's a great way to check to see what habits you have. Now, we're going to coach you through this, get you guys going through some guided breathing here. And again, let's go through the position. So low back all the way into the chair back, upper back all the way back, tailbone tucked underneath you. It should feel like you're slouching a little bit. Feet flat on the ground, knees higher than your hips. We're going to put one hand on the chest, one hand on the belly. We use our hands to help cue our body to do what we want. Okay, and just relax your elbows now down to your sides. And if you want, you can close your eyes. You don't need to see me for this part. All I want you to do is get a sense of what's happening to your body and just observe it. Allow yourself to get air in. Do not restrict your air at this point. Our purpose right now is to focus on the exhalation and changing that, not the inhalation. So get in the air that you need to get in. Now, close your eyes and here we go. Gentle breath in your nose. Think air goes into your nose. Pause and blow out through your mouth or straw. Hear the air whooshing out. Now hold your breath. Hold your breath and breathe in. Gentle breath in your nose. Think of the air going in passively. Pause and blow out. Feel the chest dropping down as you blow out through your mouth. Hear the air whooshing out. Hold and breathe in. Gentle breath in. Feel the air go in your nose, passively towards your throat. Pause and blow out. Feel your chest melt down and in as you blow out. Feel your belly spill out. Hold and breathe in. Gentle breath in. Feel the air go in your nose to your throat passively. Pause and blow out. Feel your chest melt away from your hand as your belly spills out into your other hand. Hold. Now breathe in. Gentle breath in. Feel the air go in without effort. Pause and blow out. Chest melts down and in. Feel the armpits relax as your belly spills out. Hold your breath. Hold and breathe in. Gentle breath in. Feel the air go in your nose to your throat passively and blow out. Feel your collarbones drop away from your chin. Good. Feel it melting away from your hand. Hold. Hold and breathe in. Gentle breath in your nose to your throat, keeping the shoulders down and relaxed. Pause and blow out. Feel your chest melt down and in. Ribs are dropping down as your low back lets go. Hold. Hold and breathe in. Keep that low back relaxed as you breathe in your nose passively. Pause and blow out. Chest melts in. Ribs are dropping down. Let that belly spill out as your butt cheeks settle into the chair. Hold and breathe in. Gentle breath in your nose to your throat, keeping your shoulders down and relaxed. Pause and blow out. Feel your chest melt down and in. Ribs are dropping down as your belly spills out. Hold. Hold and breathe in. Keep that low back relaxed as you feel air go in your nose to your throat to your lungs. Pause and blow out. Feel the chest melt down and in. Ribs are dropping down as your belly spills out. Hold. Hold and breathe in. Keep that low back relaxed as you breathe in your nose to your throat passively. Pause and blow out. Feel your pecs relax as your chest melts in, shoulders drop down, and belly spills out. Hold and breathe in. Keep those shoulders down and relaxed as you inhale in your nose to your throat. Pause and blow out. Feel the breastbone melt down and in. Ribs are dropping down as your belly spills out. Hold. Hold and breathe in. Keep that low back relaxed. Feel the air go in your nose, passively to your throat. Pause and blow out. Feel that breastbone melt in, relieving you of pressure as your belly spills out. Hold. Hold and take a break. So I hope you guys could feel at least your chest dropping down, your belly spilling out. That was what was the intention for this exercise, is to give you a general relaxation throughout your body, but to teach you how to start letting this breastbone melt in as you exhale and how your belly spills out as you exhale. Often we try to suck up our gut as we exhale. We want to let our belly out so our rib cage can drop down, so our muscles can support our diaphragm when we inhale. It seems very counterintuitive, but let me tell you, the way you breathe and position your body has led you to pain, tightness, and flexibility that you're in right now, and you can shift and change out of that. I've helped way too many people get out of surgeries, pain issues, helped runners run 50 miles pain-free, like all of these things just by changing the way we position ourselves and breathe. Now, these are the basics that we just went through, and we can shift you even further. So where you go from here is up to you. You can practice this, but if you're still having issues, there are ways to address your specific pains, because there are things like reaching, how you walk, all those things that shift based on learning how to change how you breathe and position your body. Then you learn how to activate certain muscles that you didn't even know exist, and deactivate ones that are overworked. And when you use this breathing and body positioning changes, you change the way you feel your body and the way it moves, and you have this freedom of movement. So I hope that was helpful. Ken, do you have any questions for me?
Yeah, so question was, when we start doing this, how long do we do it
Yes.
to start with?
Yes, so thank you. Good question. Now, I tell people do it for about 5 minutes. When you wake up, for about 5 minutes, before lunch, before dinner, and before you go to bed. So I say about 4 minutes, or 4 times a day, about 5 minutes. Now, can you do it less than that? Obviously, of course. I'll take any practice you can give me. You can do it longer. Yes, if you want to. What you're looking for is to feel a change in your body and then breathe a couple more minutes so you rewire your nervous system and you feel yourself accepting and memorizing and absorbing that change that you felt, because that's you changing yourself internally. And then you practice it a couple times a day so it breaks up your old habits. I'd rather you do that than spend a half hour in the morning and be done with it. It's not going to do as good.
So anytime you think about it, try to do it, basically. That's how a good way of practicing.
Yeah, if you're sitting at a stoplight and it's a safe situation, you can sit there and practice breathing while you're sitting at the stoplight waiting for it to turn green. Great time.
Oh, cool.
Yeah.
Cool. So,
yeah.
I mean, it was tremendous help. I was practicing while you were walking us through, and I could really feel the muscles relaxing.
Good.
Now, when I do meditation, a lot of times, sometimes I go to sleep. when I do something like this, is it good, bad?
Yeah, actually, I put a lot of people to sleep, and it's a good thing because it's telling you, one, your body needs it. So you're having trouble getting all the sleep you need at night. So if you can fall asleep very quickly with something like this, that means your body needs it. Now, obviously, in the middle of the day, we can't go to sleep, but it's a great way to calm you down. So it helps you. It's very interesting to explain it, but it helps you just have this calm about you. So when things come at you, you're not so reactive. Yes. And our tempers and emotions don't take over. It helps you stay calm. And I'll say this, I have people who sometimes get annoyed at me because they're like, okay, hurry, hurry, hurry. And I used to be that way. But now I'm like, okay, I'll get it. I'm not going to ramp up my nervous system because I don't need to. It's not going to make me go any faster or do something more efficiently. I'm very efficient at being calm because I can think through things and perform at a better level.
Gotcha. So you'll be more
Yeah,
present.
absolutely. Yeah,
Gotcha. So
absolutely.
curious, how do people reach out to you, or
Sure.
where can they find you?
Yeah, so they can reach out to me if they have questions, they want other resources. Please have them send me an email, amy@paberinstitute.com. That's PABR Institute.com. And I also do free 15-minute consults if they want to have a further chat. Just have them put in the email address, the subject line, your pharmacy name and how they heard of me. So through you, so I know it helps me know what I've already said.
Okay.
And that way I won't repeat it when we're having a free 15-minute consult.
Gotcha.
But they can also go to my website, paberinstitute.com. There's tons of videos on there. I have a wellness show on there that has other information about other healthcare fields, but that's the best ways to get a hold of me.
All right. Awesome. And then I know for local folks down here, your office is in Scottsdale, so not too far from here.
Yes, well, actually, so during it has been up until the pandemic. I had to close down during the pandemic because, we're in close quarters. And so I actually switched to virtual. So
Oh, nice.
I do this virtually with people, and I'm serious, all over the world.
That's good.
And I record the sessions and I give them the link to the session so they can watch it and practice. But I also have a little practice up in Sedona, where I do see occasionally people, and it's a way that I have a window, so I can have an air filter window, and it's a safer situation instead of
Gotcha.
a closed office situation where I couldn't really control the air quality so much.
Gotcha. Awesome. Thank you so much. This was quite informative and very, very well. I think if the patient starts doing this, they will see the difference. And I think
Yeah.
from my side, I mean, last 4 or 5 years, I've done everything possible that I could do to reduce the opioid use and
Yeah.
abuse, I should say. So this is another way of helping patients. There's a way if they put their mind to it, and it's simple. It's breathing. We
Yeah.
do it regularly. Try
Absolutely.
missing one beat and you'll know.
Exactly. And we don't realize there's a technique to it. Just like
Correct.
there is for everything else in our life. There's a technique to breathing.
Absolutely. So thank you
Yeah.
so much. Really, really appreciate your time.
Thank you so much for having me on. I really appreciate you and Right Way Pharmacy for caring so much about your clients and
Thank
patients.
you.